I'm Philip Brady. I'm a consultant orthopaedic surgeon at Blackrock Clinic in Blackrock Health. If you're reluctant to consider knee replacement surgery because you feel there may be a long and difficult recovery ahead, what I'd say to you is, if your symptoms are having an impact on your quality of life, if life's on hold professionally, socially, recreationally, if you've exhausted every other option that's available to you, bar the surgical option, well then you should give serious consideration to knee replacement surgery and engage in the prehabilitation process and the pre-assessment process that your surgeon and your care team will offer you and see if it's right for you. And it may allay some of the fears that you have that might be related to other people's experiences that you've heard anecdotally in the past. But remember, every treatment, despite the same surgery being done for a number of people, every treatment is bespoke for the needs of that individual patient. And you may find that your recovery is easier than you thought. If you're experiencing bad knee pain, talk to your GP, talk to your physiotherapist, arrange an assessment, which will probably include an X-ray, and following that, a decision will be made on whether you need to see an orthopaedic surgeon or an expert. It's wonderful to share in people's experience when they return to clinic and you hear them describing plans being made after their surgery, plans they would never have considered doing ahead of their surgery because they were feeling older, wondering, is this it for me? Am I slowing down? Am I going to live with pain for the rest of my life?